All right. Good morning, everyone. I am Rachel Fisher. I am one of the directors of the Adolescent PHP over at Compass Health Center. And Heather?
Heather Abels. I am the Director of Education in our adolescent program in Northbrook. And Rachel and I have both been at Compass for a really long time. And we've been able to serve on lots of treatment teams together and have been working with many schools together during this time of the school closures. And so we're really excited and honored that you guys chose to spend your precious time with us. We appreciate it.
And we're grateful for this partnership with D113. We did a webinar last week, Wednesday night, I think, and it really was a really great conversation between families, students, and a couple of members of our treatment team with moderators from Highland Park. So we're piggybacking on that initial event and doing another professional development that we're hoping you guys will join us tomorrow as well. So we will get rolling. All right, before we get into an overview of today's session, we just wanted to put out there that we intentionally made today's slides even less formal than many of the other webinars that we've done over the last couple of months, really wanting and knowing that you are a day away from your summer break, and that we want this to be meaningful for all of you. So whether it's using the chat feature, which will only go to Heather and I, or raising your virtual hand, which I think right now I can't see, so maybe the chat feature only. And then we will open up to a Q&A at the very end, but we're going to be pausing throughout to really elicit conversation, answer some of the questions or concerns that you guys have had looking backwards over the last several months since such shelter in place went into effect, but also in a meaningful way looking forward, knowing that we don't have all the answers for fall, but I know that there's been lots of discussions and planning, and I think there are aspects of the last couple of months that have worked well for students and for staff. And obviously we want to, given the title of today's session, we want to acknowledge that it has also been exhausting and overwhelming and anxiety inducing and very different than everyone's typical school year. So a couple of the key points we hope to hit on is just acknowledging, the impact of the COVID-19 pandemic on school personnel in general, touching on self-care, ways to really look at how we've been affected both positively and negatively, but also really maximizing opportunities to heal, to rejuvenate as we look forward to the fall. And lastly, like I just said, thinking ahead, planning ahead, trying to figure out socially and emotionally how we're going to hit students in a different way, and acknowledge kind of what they just experienced at the end of last school year. And then obviously hoping to leave some time for Q&A. All right.
So we are, again, so thankful that you all are here with us today. We want to really think about connection and connectivity and, what's been really helpful. What have you done in the past moving forward? What have you been doing currently to stay connected with your students, with your colleagues? And moving forward, what could change? We know that connection is really important, and that has been really, really different for all of us as we've moved into this remote learning time. And so take a moment to use the chat. You don't have to answer all the questions, but go ahead and answer any that you think, just to sort of process through your own mind about the connectivity.
Whether it's within your, a few minutes. Yeah, whether it's within your department, whether it's the school as a whole, whether it's as the district. What ways did you guys create connection prior? And what are some ways that you feel like we had to adapt in order to meet the needs of students and families during the pandemic? All right, and comments are starting to roll in. We will not be using names, So feel free to give any thoughts, concerns, things that you wish could have been different, or things that you felt worked.
We've got a couple. And really think about also, just what you did before, how you felt that connection. I know that, we're feeling it too at Compass. Even those closed door, no kids around, quick conversations, that quick vent, the quick joke, the inside jokes that you have running through your teams. So as I'm looking at the chat here, and we're not going to go through all of them, but I'm seeing a lot of themes coming up. Just the little moments throughout the day. It sounds like your teams at in 113 have done a nice job of trying to schedule some fun hangouts, theme parties with staff and with students. I think that one thing that I'm seeing a lot too is that it's hard to stay connected to colleagues, especially if it's someone that's not working with you daily, if you're not on a specific team. And so that's something as a district for you guys to talk about and to consider as we move forward through this. And that those face-to-face meetings are really important.
I mean, I feel like I'm sifting through these and seeing that being in person is still the preference. And I think we're very used to it. It feels more instinctual, especially given we're all in a field where interpersonal relationships are so valued. I see also the sheer numbers. So trying to connect with 20 students at a time versus those before school, during lunch, after school connections with one individual student. Google Forms, Google Hangouts, texts. I also see a lot of room for improvement.
Yeah.
Whether more intentionally scheduling things, whether as a team, a department, a district, more opportunities for connection.
So just something to keep in mind. And as Rachel and I were talking about what would be really helpful in this in this time we have with you, that connectivity is really sort of just the foundation for everything else.
And I think that was the initial phase of grief and loss, even for our teams at Compass, trying to put a name to what we were all experiencing. There was this tremendous void. And I think as a lot of you have probably read through a lot of the research that is already coming out, that sheer exhaustion, but yet we haven't had any of the in-person interactions, and yet we're feeling so depleted, whether that's a result of the screen and the blue light or the lack of emotion that's evoked by having in-person interactions. I think it was very challenging. And that's why we really put it at number one in terms of the impact on mental health. Just knowing that, that sense of belonging and connection, both to your colleagues, when you're used to sharing an office space with maybe your entire department or a couple of other staff members, missing their faces, missing the that downtime, that personal information, jokes, humor, laughs, nonverbal cues, but also missing the connections to students and families. And I think I saw in one of the comments, one student really learned that grades were frozen and the impact might be more minimal, that people were kind of falling off in terms of their attendance or presence in your classrooms. And that I'm sure felt very, sad, but also lonely and a little bit hopeless, I'm guessing.
So we just wanted to really hear and see that there's been a big impact on all educators with this change in the model, and it happened so very quickly. I did see one comment about just the fatigue at the end of the day. And so while we want to be connected and we want to have these Zoom meetings and parties, and, at Compass too, they have, these happy hours that are put in place. And there are some days where, I can't look at the computer for one more second, and I don't want to do this anymore. And so that's real. Some of the other things we've been hearing from teachers and educators, and we'll hit on this too, is just the lack of the boundaries in the schedule and how important it is. And again, this is something that we're experiencing, just the emails, being on call 24/7, really having a hard time separating and knowing when to make those boundaries, and how important those boundaries are. And then just wearing all of those different hats, the professional, you're trying to be a parent or a child, take care of your older parents. And then as an educator, you're probably doing things you've never had to do before. I was, put into group where I've never been in group before. I had to learn how to do all that. And it's like being a first year teacher all over again, in a lot of ways. And, really, really trying to be okay with making those boundaries. Sorry, Rach.
No, I was going to say, the one thing that I heard you say numerous times, having adolescent children of your own, was just, trying to meet the needs of your own family, and shuffling that then with also this ever-changing role within your career, within your school district, and trying to do both well, I think was very, very hard for all of us. And without getting into the nitty-gritties in terms of expectations from the district families and the community at large, I think, meeting the needs of every student, whether it was an AP student or an IEP student, was really quite a challenge to do and put together in, such short notice. I mean, we put together our entire virtual program in a week. And I think, as I've seen in the comments also, that it worked for some, it didn't work for others. And needing to be adaptive and flexible, while also recognizing there's going to be disappointment, that expectations can't be met across the board when this was a learning curve for everybody. And then lastly,
educators can be a little perfectionistic. We don't like to let people down. And so I'm sure that's been really hard for everyone as well.
And then lastly, obviously the title of the presentation today and why we're here from Compass, recognizing that, a lot of mental health symptoms that were either there to begin with or were exacerbated as a result of the pandemic. We want to ensure that, obviously for some of you that have some weeks or months off over the next couple of months, that you really, look at what symptoms of your own have regressed in some way, and whether that's seeking out treatment, whether that's, bringing social back into your world, even if it's at a social distance or with a small group of people. But I think that everyone went into go mode, and there wasn't really that opportunity to stop and pause and really see, wow, I have felt really overwhelmed of late, or anxious or fearful, or angry or frustrated or mad, and really looking at kind of where you're at emotionally, so that the summer and pre-fall can be used to recharge, because your roles as educators and school personnel is crucial. And the way that we model our emotional well-being going into the fall, I think, will be imperative, because I think there's going to be a lot of fear and anxiety going into the school year, and kids have not seen their friends and have not seen their teachers in person, and navigated all of that. So really, really honing in on our mental health, both now with your colleagues, and then throughout the summer with whomever your support people may be. All right, self-care. One that I think that for sure for many of us has gone by the wayside when we have been go and trying to go from Zoom call to Zoom meeting to Zoom call to yet another meeting or planning. And there were a couple that really stood out to Heather and I when we found these two images. But again, we want to go back to the chat feature for a second and make this about what you guys need, or what resonates with you. Are there a few that stand out in terms of self-care? What feels harder for you? What feels like, sleep, I make sure to power down my phone at 9 o'clock. Not me so much, but maybe that's the easier one for you. but use the chat. Let us know. And we, again, aren't using names, but what feels like an area of self-care that you've been able to maintain, and maybe what has felt harder?
And what I love about these images is that it's not, some of the typical self-care recommendations that we've all been reading about. Go for a walk, or go, give yourself a facial. We all know those. I think these are really, really concrete, powerful things that you can do, and they're hard. So take a minute, use the chat feature. What are you doing already? What do you really find hard as an educator? And what do you think you want to work to challenge yourself to try moving forward?
Are they a little bit hard to read being small? I can zoom in a little bit more. Did that work, Heather? Can you see it zoomed in? Ooh, and now I'm way too far forward. Let me go back.
There we go. Technology is fun. And I'm guessing what you are all experiencing is probably very similar to what we're experiencing as well.
Some great comments. And yes, someone just asked if these slides will be shared. We're recording. And so both the video clip, if there are staff members who were tied up in other meetings, we'll be able to view these, but then we will send out the full slides. There aren't many of them, but this is included in there.
So I'm reading one and I'm laughing about it because I sent Rachel and Melissa Zantara a picture of my son's workspace. He's a junior at Glenbrook North. And I do executive functioning with kids for a living. And my son's workspace looks like something exploded. I mean, there's papers and cups that haven't been put away. And I've been very busy doing this and, helping my team, helping other children. And yeah, I feel like I have neglected my own kids in some way. I think that is a concern for many, many people, about how to do your job and to wear all those hats, and to do it well. Rachel, do you want to read through any of these?
Yeah, no, I'm seeing a lot of, it feels very much like you have to choose one or the other, right? You feel guilty if you're choosing to prioritize work, which doesn't disappear. And who is there to delegate it to when everyone's in a similarly difficult situation? I see, exhaustion, and, then the work just keeps piling up. Guilt-ridden for choosing self-care, difficulty with gyms being closed. And so I think what I like about these two images is that self-care can be something super small. There was one of the webinars that I think our psychiatrist did, with one of our family therapists, and choosing to say to your spouse or significant other, you know what, we're not going to have dinner together tonight. I am going for a long walk by myself. I will eat when I get back. Go ahead and eat. I need alone time. Because I think in the beginning months when it was freezing out and our homes felt like we're here all day, there was no outlet. I was finding myself taking really quiet drives by myself to nowhere. And that was okay too. And I think, again, so feeling like something goes if we prioritize our self-care, whether it's the workload. And then I'm seeing a lot of comments about our own children. Heather has adolescent children. I have little toddlers, 4 and 3. And I like that someone said, like, those are really important developmental ages too. And feeling like our kids have these big emotions and feelings about being home and mom and dad being home, or, parents being home, or lots of changes in routine. And feeling like if you miss the mark in attending to our own children, then what, right? Then we've got students and families who are struggling and our own children are struggling. But again, I want to look at the title of the slide. So self-care. Where can you interject something for you? And again, and we're going to get to this in a second, but there's a lot of, so this was all 24/7, right? Like having access to our email was 24/7. Families had access to us 24/7. There was no physical boundary between, our offices and our homes. Some of our students or families saw our kids hopping into, the Zoom calls, and that felt a little invasive at first. But I'm liking seeing that other people did drive around to nowhere, which is good to know that I wasn't alone.
Anyone else just sit in their car, in their garage? I did that.
But again, looking at the 4 different categories on the right-hand side, it could be taking a few minutes, which I was better at towards the beginning, in my notes section of my phone, and figuring out one highlight from the day. It could have been really small, but that might go under journaling, or, really practicing self-compassion, forgiving yourself that at losing it towards your significant other, your children, and saying tomorrow's going to be another day. I think that was hard towards the beginning too, knowing none of this had an end date. A physical release. So while gyms are closed, obviously there were a lot of people who did, post things online or had Zoom workouts or yoga sessions. Or now that the sun is finally shining and the weather's warming up, getting our tushies outside to do some sort of physical activity, so that we weren't sitting in front of a screen all day.
Yeah. I think also, what resonates with me is under social, which you wouldn't often think about for social, is asking for help. And it's okay to, I think, at first it was try and get everything done, doing it on my own. You want to impress your teams and your supervisors, and you want to be, super mom or super child. And it's just not possible. And asking for help is also very, very powerful. And being able to say, and being really specific. One of the things we talk about at Compass a lot is being really specific when you're asking for help, and making it not a suggestion, but that you're saying, I need this. Because if you say, could you empty the dishwasher? Your kid might do it, might not. But if you make it a very specific thing, I need your help, or we need to be a family together, then it becomes less of a burden on you.
And as you're saying that, Heather, I think that's one piece we all may be able to be doing differently. And maybe as a school or as a team or department, should we be virtual in some capacity in the fall again, figuring out a way to lean on one another. Initially, when we said sort of asking for help, it was like, well, no one wanted to get the virus. And so who are we asking for help? But I think that could mean anything. That doesn't have to mean childcare or, hey, can we do, a happy hour later? That could also mean like, hey, can I give you this task? I just cannot get it off my to-do list. Or can you help me brainstorm for this upcoming meeting? And leaning on one another, because maybe someone is feeling a little bit more caught up or a little bit more grounded in that moment. But asking for help is not easy. And it's something I think all of us need to do better at practicing. All right. And then Heather, you brought up a good example when we were talking through these slides yesterday too, with one of your close friends kind of ruminating and going through a situation with their own child, and the feedback that you gave her, I think really hit home.
The stepping back.
Mm-hmm.
Yeah. A friend of mine was really concerned about her child not being able to get to the next grade, that she was really close, her daughter's really close to getting that A and wasn't going to get it. And I said to her, look, at some point, you have to let it go. You have to wrap your head around where we're at right now and step back and move on from it. Which is, again, really, really hard, especially as perfectionists, or as teachers who are used to just being able to do it all. Taking a step back and either walking away or coming back to something later is really important.
And there's a skill that we teach for the kids and the families, and this one did come up in last week's webinar, but it's radical acceptance. And so I think that's the bigger picture of what Heather was describing to her friend. What's in your control? It's not, ensuring that 3 more assignments get turned in necessarily for your child. It's saying, this is a product of where we're at right now. That's not going to make or break the college admission process, hopefully. That we really need to take a step back, have perspective. We are healthy, we are safe, we have a roof over our head. and those that sometimes need to be our priority. And being that voice of reason for one another, I think is super important. The other one that has glared at us and is so hard is saying no. Being comfortable saying, got nothing left, can't do it. It's not going to be the super popular answer. And I think towards the beginning, like Heather was saying, we wanted to prove ourselves and we wanted to go above and beyond. And this perfectionistic tendency in all of us was really like, okay, this is uncharted territory. Here we go. And that was exhausting. And what we're going to come up to in a second, this burnout and exhaustion that we're all feeling is legitimate. So a couple more self-care thoughts is really self-compassion is up there, I think. And so, looking at practicing compassion, not only for ourselves, but not judging others. So when you are seeing that others are saying no, are we saying, oh, more for me to pick up? Or are we saying, I don't know their life circumstances right now. I can only be hopeful that they're a part of my team and they're using that at a time when they genuinely cannot do more. Social media. And again, this is one that I feel like we, hone in on constantly with the patients in our program and the families, and it comes up in family sessions, but really being mindful of the amount and the type of information that we are allowing ourselves to scroll through and setting limits on those. I think in some of our conversations when we were planning for these webinars, the sounding board, is it Facebook, Heather? Is it through Facebook?
I know that for Glenbrook North, there's a Facebook page. I know there's a sounding board for District 113 with parents.
And recognizing that, as we said before, every family, every parent, every faculty member has various expectations, and ensuring that we're not unintentionally or maybe partially intentionally creating distress that we don't need, right? We know that there's opinions out there that are super pleased with the e-learning and remote learning, and maybe there's some that are, feeling it should have been more synchronous or less synchronous or this or that, and really setting limits. And the same goes for the amount of news coverage and CNN browsing and, all the mom spots. And I think there needs to be very intentional, whether it's, I know that Heather, you do this with your own kids, but setting screen time and it powers off, or I find myself turning over my phone and just not even watching the light pop up so that I'm not, whether I'm reading a book or I'm doing something more mindful, really separating those two things and not allowing us to go down hour-long rabbit holes on social media. And then this one, obviously, we're here for a reason, but seeking out additional support if it's needed, whether it's for yourself or whether it's someone that in your department or someone you've been, working with super closely over these last couple of months just doesn't seem themselves or feels, more removed or hopeless, or comments that they're saying are concerning, maybe not going as far as safety. And certainly if that's the case, making sure that they follow through with a higher level of support, but also just recognizing it's okay to have an outlet right now, or find a therapist that's doing teletherapy, which is most, or at least, saying, I'm thinking of you. I recognize that things seem to be really challenging. Let me know if you need a listening ear.
We want to be respectful of your time. I know we don't have a whole lot of time left, but we want to take a moment to really reflect on this last school year, on the last few months of this school year, because there were some things about it that, that worked, and it worked really well. And that maybe when we go back to live, we want to continue doing. So we want to take a minute, again, use the chat feature, and think about some of the aspects of remote learning that you might want to carry on into next year. I can tell you that, again, as a parent, as members of treatment teams at Compass, and being able to work with so many kids from so many different schools, there were a lot of positive aspects of e-learning. Kids were really able to focus on treatment without worrying about makeup work, and that transition into e-learning was very easy as we compare it to our transitions back to school and these kids who have all this makeup work to do. I think that, the no final exams this time of the school year is usually so stressful, at the very end. And, I can see it with my kids. The mental health aspect has been, it's been a nice benefit to not have that extreme stress. People have been getting maybe a little bit more sleep. But think about how you've been doing assessments, how you've been giving feedback to kids, and how that, some of that might be something that you might want to hold on to. So take a minute and think about that.
I don't think we've spent enough time thinking about what did work.
Yeah. And one thing that I'm seeing as I'm looking at the comments is that there really has been even more outreach to individual kids and parents. I think teachers, for better, for worse, in terms of boundaries, teachers have been more accessible to kids. And I think kids feel more comfortable reaching out and emailing their teachers or having that connection in those one-on-one Zoom meetings or the meetings with parents and things like that.
And one that I love, there was the word rat race, that there's been so much less of that rat race, being able to have meals with family and cook and get outside and getting back to the basics of arts and crafts and things like that for our own families. So again, this is a little bit different than, what we're going to create for back to school, but something that felt good for a lot of people I'm seeing is not having to commute, being more present and at home. But then in terms of students, I'm seeing a lot, liking the ability to give choice, to differentiate, to give, options for assignments, for kids to have more project-based learning, and choose something that interests them or is more engaging to them. And how can we incorporate that? Because that feels super meaningful, that if kids felt like it was a way that they could learn that was motivating to them, how can we interject more of that?
Yeah, more of the self-paced learning, which I'm seeing over and over again too, and definitely saw that as a benefit with my own kids. And so, thank you for sharing those. As we look into the next school year,
lots of appreciation for learning all this technology, which I too have actually found to be super valuable, and things like the Kahoots and the Prezzies and even the Zooms. I mean, how can we take some of that into the school year, regardless of how much is virtual?
Never Zoomed before in my life, and now I'm Zooming all day long.
You're Zoom savvy now.
Oh, yes, absolutely. So thinking about next year, and really thinking about your routine and incorporating some of these things that worked with some of the things that you were thinking about with the self-care and tying them together. So reclaiming your routine. It is okay as a teacher to say, I will not be responding to emails after 8:00 at night. Please feel free to email me. I'll respond in the morning. Make those clear boundaries, and stick to it, which I know isn't easy because we always like to make sure that we're reaching out to all of our students whenever they need us, but really reclaim your routine.
Along those same lines, so when we hit on self-care, can we intentionally schedule in the self-care that felt good to us or that we didn't get to do when we think towards next school year? Whether it was, taking a walk before your afternoon classes, or whether it was, I loved that we did those theme days. Is there a way that we could do that in person? But needing, at times to put them on the calendar so that they actually happen. And lastly, I think this is one thing, Heather, that our team has done really well that, was something that maybe we didn't even talk about, but being out of the office, whether it was out of the virtual office or when we were back in person, I think people truly unplugged virtually. And I don't know if teachers, staff certainly interject, but were you able to say, like, I am so inundated with technology all day, on those select days that I did take off, putting the phone away, not checking the online charting system, not doing any of it, being truly present since we were bouncing from technology to technology. and
Making your weekends your weekends too.
mm-hmm.
Making your weekends your weekends. Take that time. I'm not going to check my email on Saturday. It's not going to happen.
Mm-hmm.
I need to spend time with my family or just not be there anymore.
And we don't want to certainly ignore, the fall comes with a ton of question marks. And I know over the last several days and into tomorrow, whether it's option 1, 2, 3, option 1 and 2 combined, we don't know what the fall will look like. And I think as parents and as staff, that's probably very scary and very unsettling. Trying to figure out childcare and more e-learning and our own schedules, and not knowing, where this pandemic will be and how much will reopen. But I think, not looking too far ahead and just thinking about how much has changed in such a short period of time, even in the last couple of weeks, and being hopeful, obviously, with the ongoing research and hoping that, vaccines and cures and all of this continues to move in a more positive direction, and knowing, again, what is in our control. And it's being mindful of our own mental health. It's being mindful of our own practice of self-care, setting intentional boundaries. We selected very few topics on purpose, and really using those to prioritize as we move forward. So I know we only have 3 minutes for Q&A before you guys have, I'm sure, your next meeting. Anything we didn't hit on that either we could send out resources when we send out the slides, or anything you feel like you want to impart? Certainly, again, we're not using names that you felt in terms of your own mental health or your teams or your departments or your school district. What worked? What worked? And what would you like to see improve? And we certainly can put out there to all of you kind of what your thoughts are.
And I am seeing, some comments about, this might have been the first time as educators that you've really taken 40 minutes to think about your own needs, which is really telling. We know you've worked so hard.
So I see a question that's, that really is quite straightforward. 3 key things to keep in mind when thinking about our own mental health. And I think I'm completely going off the cuff, but to me, sleep is up there. The impact of sleep on our moods, sleep on our ability to think clearly and be productive. But prioritizing sleep for me in terms of the link to mental health is huge. Taking breaks. So recognizing when we're getting close to what our kids in our program refer to as their crisis zone, but when we're almost at our capacity, whether it's we're too inundated with information or, we're too emotional about a certain topic, and stepping away, taking a break, closing the screen, closing our eyes, doing deep breathing, whatever it is we need to do. So taking breaks, sleep. Any others that stand out to you, Heather, in terms of your own mental health or those within your family?
I think, and this is what we saw over and over again in the comments, which is the setting boundaries and being really intentional about it, and being firm with your boundaries and being comfortable with them. That can be boundaries with your teammates. It can be boundaries with your family. It can be boundaries with, your friends. I think it's okay to set some limits and to stick with them. Mm-hmm. And it's hard, especially as teachers, as educators, as mental health professionals. Boundaries are not our forte. And they're so important.
All right, so we are at our time. I will ensure that these, this recording and these slides get out to you guys in the next couple of days. Feel free to use that Google form to, put any other questions or resources you may want, so that when we put together that email, we're sure that we include them as well. And thank you for taking the time. Tomorrow's will be more focused on students' mental health and things to kind of anticipate going into the fall, and things that we've seen in terms of symptoms that have emerged over the last couple of months.
Thank you all. Enjoy the rest of your day.
I'm going to stop the recording.